on.
Thank you very much. Before I talk, I'm going to talk about, before I talk about the project, I would like to talk about the patient's perspective. So what does the patient see in treating because when you go to the doctor says, okay, you have to give it. And in all lectures, doctors are who talk about the disease, not the patients. Patients are poor people. Anyway, I have diabetic type 1. The medication I take is one-time Lantus. Lantus is long-term insulin. When I take this, it takes 24 hours in my body. And I have to take Novo Rapid like 3 times a day. Like after each meal, I have to take 1 shot. And then, rather than this, I have to take my blood glucose test every time before the meal. So before the meal, I have to check how much glucose is in my blood, and they calculate how much glucose I need, and they take shots. And then, rather than this, I have to get medications for high cholesterol, because people who has diabetes has higher rate of fat, the cholesterol in their blood, as well as the heart stroke, because we have more rate of heart stroke. And then if we calculate how many times I have to shot my body to get the needle, it's like 7 times a day, which is about 2,500 times a year. So I'm talking about this year for my project. So just remember, 2,500 times you get needle in a year. And on average, I take like 50 units per day. So it means like every 100 units is 1 cc, 1 milliliters. So I take half a cc every day. So I can say this much insulin I take every year, and this much insulin has to be shot 7 times a day. Yeah. The target for this project is to find a way to lower the injections. So the minimum injections is better for the person who has diabetes. And of course, we have to keep the same efficiency, because the insulin is the only medication we take for treating, not treating, because treating is you have to be fine after treatment. But it's not treating, it's like management. So the disease is getting managed. So for this project, I'm going to introduce a new technology to help the diabetic people. And of course, we are going to lower the treatment cost, because all these medication and insulin pump, I have it too, but I don't like it for some reasons, because it's more rate of infection, because it should be there like for 4 or 5 days, and sometimes it gets pulled from your body, and when it goes back, it's like a stab. I don't like it anyway. And the overall project is to give insulin as an implant for a long period of time. For this project, we have some approach to go. First of all, we are going to improve the insulin efficiency in 2 different ways. One is changing the molecular structure for insulin. And for this one, we are going to do the bioinformatics to study whatever happens in the past in different animals. We reach the multiple sequence alignment, and then we are going to change the sequence, because the purpose is to make this amount of insulin to like a couple cc, and do this like an implant inside the body. And we use other techniques like nanotechnology. I go for this later. And then if we change the molecular structure, we have a better efficient, more efficient insulin because we can do that. If we read the molecule insulin, the insulin molecule, we can figure out which parts are more important, and we change the amino acid sequence to get a better, more efficient sequence. And we are still working on this. And then the other thing we are looking for is to increase the half-life of insulin. After the insulin is doing its job, it's getting catabolized in the body. So we are going to keep this molecule so that the catabolism goes lower. So the molecule doesn't get distracted and it stays more efficient. So we need less insulin. Another technique we are using is to use the nano implants as a valve to deliver adequate amount of insulin. So what we are going to do, I don't know how it works. What we are going to do is to prepare the insulin, the modified insulin, in a capsule, and we implant the capsule under the skin. And this capsule has a valve. The valve has immobilized enzyme, and it is always closed. But the molecules we use there is sensitive to glucose level. So wherever the glucose level goes high, the capsule, the valve is open. It's automatically. It doesn't need any battery. It doesn't need anything. So when the glucose level goes high, the pump opens, and there is a little bit insulin outside, and the insulin lowers the blood glucose, and it responds to blood glucose. Okay. See, we missed that. Yes. Okay. So that's the purpose of the study, is that if there is any way we can manage the diabetics or we can change the route of administration. So this project is offering a new drug delivery to the system. So after this, okay. For multiple sequencing alignment, we are trying to study the alignment based on the taxonomy, not based on the molecule or whatever. And we are going to see what happens in the past until now. And if we have the past, we can have the future. So we can predict what happens in future. So what changes will happen in future in an insulin molecule. So if we have it, we can predict what we are looking for in future. But this approach is not accurate. We are trying to figure out what happens in future. But the problem is that the insulin is not working by itself. As Lynn said, the insulin is working with the receptor. So whatever mutation happens in insulin, it should happen in receptor to them to work together. So another approach we are following is to study the three-dimensional shape of insulin, and in order to modify the insulin. So we have to keep the same shape but different amino acid to change the efficiency, as long as to change the half-life, to increase the half-life. So, and then we have to test this device on animals, and if it works, we can transfer this to human being. And of course, the biggest limitation for this project is the money. So we are looking for some investors to do this job for us. The next step is to make the nanotechnology valve, which is critical part for this project. And Singh is supposed to work on this project. And I want to ask